Apple Health 2024, a year in review. Brought to you by Eligibility Policy Innovation and Community Support within IT Innovation and Customer Experience Administration at the Washington State Healthcare Authority. The topics we will cover in today's webinar are Apple Health expansion, deferred action for childhood arrivals, Medicare savings programs, Apple Health for pregnancy and after pregnancy coverage, Apple Health for workers with disabilities, Consumer Notices Workgroup, and we will share some additional resources. Apple Health expansion. Enrollment cap status. On June 20th, HCA began enrolling eligible individuals into Apple Health expansion with coverage beginning July 1st. The enrollment limit for Apple Health expansion has been met at this time. The enrollment cap was met for individuals aged 19 through 64 on June 21st, and for individuals over the age of 65 on July 3rd. Enrollment management policy. HCA has a short-term enrollment management policy in place. When space is available, the agency will enroll randomly selected individuals who were denied Apple Health expansion due to the enrollment cap. This will include those enrolled in emergency medical, those denied after completing their renewal for the After Pregnancy Coverage Program, individuals who are turning 19 years old and aging out of their Apple Health for Kids program, and qualified health plan enrollees whose income is at or under 138% of the federal poverty level. Apple Health expansion denials. As of November 13, 2024, a total of 11,462 individuals were found eligible for Apple Health expansion, but were denied due to the enrollment cap. This includes individuals eligible for emergency medical since Go Live, those transitioning from Apple Health for Kids or after pregnancy coverage, and those enrolled in immigrant healthcare. There are denials in 35 out of the 39 counties in Washington State. Next steps. System updates in April of 2025 to accommodate deferred action for childhood arrivals changes. We are moving forward with looking at best options for implementation of an Apple Health expansion automated waitlist. We are waiting on further Apple Health expansion enrollment data to determine as we continue to monitor impact and utilization of the program. And we are waiting on legislature for potential funding to expand Apple Health expansion. Apple Health expansion resources. This slide shows 4 websites that you can visit for additional Apple Health information, including the client web page, the stakeholder web page, Apple Health for non-citizens, and the enrollment cap announcement. Deferred Action for Childhood Arrivals, also known as DACA. What is DACA? Deferred Action for Childhood Arrivals, also known as DACA or the DREAM Act, is a program that protects undocumented immigrants who entered the United States as children from deportation and allows them to work legally in the United States. DACA recipients may be eligible for Social Security numbers and can work and pay federal and state taxes. DACA recipients may be eligible for a driver's license or state ID and could be eligible for state-funded programs such as children's medical, pregnancy medical, after pregnancy coverage, and emergency medical services. They may attend college and could be eligible for state and institutional financial aid and scholarships. Clients with DACA immigration status are not eligible for federally funded programs or assistance. This is because DACA is a non-qualified immigration status. DACA recipients cannot receive any federal benefits such as Social Security, food stamps, federal financial aid, and any federally funded health care coverage, including the Children's Health Insurance Program, otherwise known as CHIP, or the Affordable Care Act insurance. Additionally, DACA recipients cannot vote. What has changed? As of July 1st, adults 19 years and older who do not qualify for Apple Health or federal subsidies based on immigration status, including DACA, may now apply for Apple Health expansion with income at or below 138% of the federal poverty level. Beginning November 1st, individuals without a federally recognized immigration status, including DACA, may now purchase a non-federally subsidized qualified health plan and qualified dental plan. The U.S. Department of Health and Human Services, through the Center for Medicare and Medicaid Services, has published a final rule modifying the definition of lawfully present to include DACA. This change allows DACA recipients to enroll in a qualified health plan through the health insurance marketplace. This change was effective November 1st, 2024. Apple Health eligibility. With this change, starting November 1st, 2024, DACA recipients will no longer be eligible for Apple Health expansion, but will continue to be eligible for state-funded programs including children's medical, pregnancy medical, after pregnancy coverage, and emergency medical. What steps should I take? Individuals currently active on Apple Health expansion will continue receiving coverage. Apple Health expansion coverage will continue and will not transition unless the immigration status is updated in Washington Health Plan Finder. Individuals can continue to apply for state-funded programs, including children, pregnancy, after pregnancy coverage, and emergency medical. Individuals currently not active on Apple Health expansion due to the enrollment cap having been met can apply through Washington Health Plan Finder to purchase a qualified health plan. Medicare Savings Program. Medicare savings programs help pay some of the costs that Medicare does not cover, such as Part A premiums, Part B premiums, deductibles, and co-insurance. To be eligible for MSP, individuals must be entitled to receive Medicare Part A and meet general eligibility rules outlined in Washington Administrative Code 182-503-0505. They must also meet the MSP income limits. There is no resource or asset limit to qualify for MSP. Annual income limits increase each April. This slide shows the individual MSP income limit increases that occurred April of 2024. Apple Health for pregnant individuals and after pregnancy coverage. APC background. Prior to the expansion of postpartum coverage in June of 2022, pregnant people on Apple Health automatically received 60 days of postpartum coverage the following month after their pregnancy ended. After the 60-day postpartum period, individuals received notification to renew their coverage to determine if they qualify for Apple Health programs. If not eligible or no action was taken by the individual, the postpartum coverage would transition to 10 months of family planning only. In 2021, State Bill 5068 was passed to improve maternal outcomes by extending postpartum coverage from 60 days after a pregnancy ends to 12 months. A work group was created with participants who represent managed care organizations, providers, advocates, and midwives. The work group named the program After Pregnancy Coverage. The program was implemented in June 2022. In March 2024, State Bill 5580 was passed with continued focus on improving maternal support by creating a post-delivery and transitional care program to allow for extended post-delivery hospital care for people with a substance use disorder at time of delivery. This also allows for up to 5 additional days of hospitalization stay for the birth parent and directs HCA to increase the federal poverty level to 210% for all pregnancy Medicaid programs effective November 1st, 2024. Active on Apple Health. Pregnant individuals who are active on an Apple Health program are automatically eligible for 12 months of postpartum coverage. The transition to APC is automatic if there is an estimated due date reported during the pregnancy. APC will begin the first day of the following month the pregnancy ends, regardless of any pregnancy outcome. Coverage is for 12 months regardless of a change in income or household size. View more at hca.wa.gov/APC. New to Apple Health. Individuals not active on Apple Health may apply for APC and must meet the following eligibility requirements. Had a pregnancy end within 12 months when applying, reside in Washington State, have accountable income equal to or below 210% of the federal poverty level, and not be active in another Apple Health program. Immigration status does not apply. Coverage begins the month the individual applies and is found eligible. Coverage continues until the 12th month after the pregnancy ends. Increased income standards. This slide shows the new federal poverty level increase of 210% that went into effect in November of 2024. The numbers shown on this slide include the 5% income disregard. Covered services. After pregnancy coverage is full scope Medicaid coverage. The benefit package includes all services covered during pregnancy and includes but is not limited to physical health, such as primary care, specialty care, urgent and emergency care, behavioral health, such as mental health and substance use disorder treatment services, oral and dental health, and hospital services both inpatient and outpatient. You can learn more about covered services at the website below. Apple Health for Workers with Disabilities. Program Overview. Apple Health for Workers with Disabilities, or HWD, is a program that supports individuals with disabilities who want to work by not imposing an income or asset test. If an individual is eligible for one of the following programs, they do not need HWD. Apple Health for Adults, Apple Health for Pregnant Individuals, Supplemental Security Income, Medicaid protection under Section 1619B of the Social Security Act. Who qualifies? To qualify, individuals must be a Washington State resident, be employed full or part-time, including self-employment, and meet federal disability requirements. There is no income limit or test for resources. For more information, view Washington Administrative Code 182-511-1050. Program benefits. Individuals approved for Apple Health for Workers with Disabilities will have less out-of-pocket costs since premiums cannot exceed 7.5% of total income. Categorically needy Medicaid coverage for 12 months if monthly premiums are paid. For more information, visit Washington Administrative Code 182-511-1000. Monthly premiums. We use two calculations to determine the monthly premium amount. The premium is the lesser of these two amounts. 7.5% of total income, or the total of 50% of unearned income above the SSI standard of $943, 5% of all unearned income, and 2.5% of earned income after deducting $65. New resource exclusion. HWD enrollees can save earnings that will not be counted for other Medicaid eligibility in the future. To make this happen, the enrollee must designate a separate account for their earnings, not commingle funds with other income, and cooperate with DSHS to establish and identify the account and maintain its exclusion when applying for a different Medicaid program after HWD. Note that funds in this or any other account do not affect eligibility for HWD. There are multiple new outreach materials to promote the Apple Health for Workers with Disabilities program. We have a video that is available in a 30-second standard format and a 15-second vertical format for posting on social media platforms. These have also been translated into Spanish. You can find the English and Spanish videos online at hca.wa.gov/HWD. The general HWD outreach flyer is also available in English and Spanish. The RAC card shown here is a smaller version of the flyer and available in English. We also have materials designed for a native audience, including the flyer shown on this slide. View the Outreach Toolkit to access the flyer, videos, and social media posts. Individuals interested in applying for HWD have several options. They can apply online at washingtonconnection.org or mail or fax an application to DSHS. You may also call the 1-800 number to request that an application be sent. HWD eligibility is assigned to two different divisions within DSHS. The Developmental Disabilities Administration, or DDA, HWD team has designated staff who determine the eligibility for those on DDA services and for individuals who are not on long-term services and supports with home and community services. Home and Community Services, or HCS, has designated staff in each region to maintain HWD cases for individuals who receive HCS long-term services and supports. If you need LTSS, apply through Washington Connection or contact your local HCS office. This slide shows the additional resources and information about HWD as well as the HWD fact sheet. Apple Health Consumer Notices Workgroup. The Consumer Notices Workgroup reviews Washington Apple Health Medicaid notices that are sent via Washington Health Plan Finder to increase readability and accessibility for consumers. This collaborative work group is comprised of staff from multiple agencies, managed care organizations, stakeholders at Northwest Health Law Advocates, and consumers. The work group reviewed and approved 8 notices in 2024. Work group meetings are scheduled on the last Wednesday of each month from 1:30 to 3:30 p.m. All meetings are virtual through Zoom. Agendas are sent a week prior to the meeting with all information for the upcoming meeting, including the Zoom meeting link. Consumer participants receive a $50 gift card each quarter as compensation for their participation. We are currently recruiting consumer participants. To participate in the work group as a consumer, please contact Jasmine San Nicolas at jasmine.sannicolas@hca.wa.gov. Examples of the Consumer Notices Workgroup final products can be found at the link below. Resources. Welcome to Washington Apple Health video series. The Healthcare Authority has released the next Apple Health Medicaid video in a series created to complement what is shared in the Welcome to Washington Apple Health Benefits booklet. A link to the client-specific booklet is shared at the time of approval for Apple Health coverage through their Provider One enrollment notice. These videos help clients learn about their health coverage in short segments to reach a broader audience and account for different learning styles. The Welcome to Washington Apple Health 2023 video is about finding out if you are eligible and how to apply for Apple Health coverage. The 2024 video is about understanding your Apple Health coverage, and the 2025 video is about using Apple Health coverage. Community event requests. Do you want HCA to join your event in person or virtually? If so, please contact Apple Health Communications at ahcommunications@hca.wa.gov. Cross-Agency Desk Aid. The Cross-Agency Desk Aid includes contact information for DSHS, HBE, HCA, OIC, and additional supports. Follow Healthcare Authority on all major social media platforms, including Instagram. Subscribe to our Gov Delivery to receive weekly Apple Health updates and general information. Don't forget to visit the Stakeholder and Training page, where you will find refresher training on topics such as the post-eligibility review process, as well as our Apple Health quarterly webinars. Thank you for joining the fourth quarter Apple Health webinar. At this time, we'd like to take any questions.